So we're going to go ahead and get started now. So welcome again, everyone. We're really pleased that you can all join us today for our fourth Project Firstline Echo session. If you do have any IT difficulty during today's call, please chat directly to our chat monitor, Alyssa Longi, in the direct chat, and she will assist you. Next slide. So just a bit of housekeeping here. Please feel free to turn on your videos, mute your microphones, type any questions into the chat box. Please note that this session will also be recorded for educational and quality improvement purposes. Next slide, please. So Project Echo collects registration, participation, questions and answers, chat comments, and more for some tele-echo programs. So your individual data will be kept confidential, but this data might be used for reports, maps, communications, and more to inform new initiatives. The Echo session will be audio and video recorded. Your participation today confirms your consent to recording. These recordings will be used for program quality improvement and potentially future training opportunities. If you are participating via audio or phone only, please announce your name and location or put that information in the chat box. Next slide, please. Please note that only the introduction and lecture portions of this presentation will be recorded for educational and quality improvement purposes. No PHI or protected health information is to be disclosed. All patient information related to the case discussion will be de-identified for the presentation during this Echo session, and only case ID numbers or Echo IDs will be used. Please do not share any protected health information or PHI during the Echo session. Next slide, please. So here is the agenda for today's session. We're going to have a lecture from Karen Kwok, as well as commentary from Dr. Carlson from the CDC. And just a reminder that we will be having a case discussion after the commentary finishes, so please don't leave after that. Next slide, please. So NCUIH is a national nonprofit devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH strives to create a broad awareness of Indian health issues while maintaining a visible presence in DC. We hold conferences, webinars, and host an interactive website that helps to disseminate information and facilities partnerships. Next slide, please. So I'm Sophie Chishti. I'll be your host and facilitator today, and I'm a public health associate with NCUIH. And we were supposed to have Marie Zepp here as our case facilitator today, but she's not with us today, so we'll be having Alyssa Longi take over. Next slide, please. We'd like to thank the CDC for their continued support. Project Firstline is a national collaborative led by the CDC to provide infection control training and education to frontline healthcare workers and public health personnel. NCUIH is proud to partner with Project Firstline. The contents of this program do not necessarily represent the policies of AAAHC accreditation body, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Next slide, please. So now we're going to move into an icebreaker, just to get everyone's muscles and memory muscles moving and get everyone excited for today's session. Next slide, please. So just to start things off, we have a quick riddle here. So you can feel free to answer in the chat, but the riddle is, I have cities, but no houses. I have mountains, but no trees. I have water, but no fish. What am I? Feel free to answer in the chat or shout out responses by unmuting yourself if you would like. Do we have any guesses? All right, if there are no guesses, we can move on to the next slide to show the answer. And the answer was a map. We can move on to the next slide, please. So for our icebreaker today, we'll be using Poll Everywhere. So you can all give your responses in real time, and note that these are anonymous responses. So if you are using a computer, you can open the link provided to participate. It's at polleb.com. And you can enter WiredSun334 to respond to the activity. If you're using a cell phone, you can text WiredSun334 to 22333 and text your message to respond. And Alyssa will be adding all of this information to the chat as well. Next slide, please. So now it's time for an icebreaker question to get to know everybody today. So what city are you joining us from today? So as you respond, if you notice some responses are getting bigger, that means more people have been entering that response. So a lot of people must be joining from that city. And just to note that with the poll everywhere format, if the city you're coming from is more than one word, it may split it up into different responses. So if you want to use a dash or a comma or something else to keep it all as one word, that way we can see them more easily. And it looks like some of the cities that people are joining us from include Boston, Decatur, Washington, I see Falls Church, Bakersfield, DC, I see Eugene. We have someone from Chicago, see that in the chat. Got lots of people from Bakersfield, apparently. Take a few more moments to let people respond if they haven't already. I see Fresno in the chat as well. All right, looks like we have a lot of respondents from Bakersfield. Thank you all for joining us from wherever you are today. Do you want to move to the next slide? All right, and just a quick reminder to complete a survey on today's session so that we can continue to improve our presentations. So here's a QR code that'll lead you to the survey. You can feel free to scan that with your phones as we go through the session. Each slide in our presentation today should carry this QR code in the bottom left-hand corner of your screen so you can easily access it. Next slide, please. And Alyssa is sharing the link for the survey in the chat as well. And your feedback matters to us. So here are a few examples of some of the questions in the survey so that you can get an idea of what the survey is like. Next slide, please. So here are our learning objectives for today. To 1, recap how germs spread from the respiratory system and cause harm with key examples. 2, to understand specific reservoirs in healthcare as they relate to COVID-19 and what actions can be taken to prevent the spread. And 3, to apply risk recognition strategies through case discussion and discuss where we are today with the COVID-19 pandemic. Next slide, please. So now we're going to transition into the lecture portion of today's session. Next slide, please. So our lecturer today is Karen. Karen holds a dual master's degree in nursing and public health and is nationally certified as a family nurse practitioner. She has over 20 years of experience working in health equity, including coordinating care for UIO patients in San Francisco. I will hand it over to Karen. Thank you.
Thank you, Sophie. For the next slide, please. We are reviewing the reservoirs for recognition of infection risks, which depends on understanding where germs live in relation to our bodies and in the environment. Thinking of patient care interactions in terms of reservoirs help us recognize where there is the risk for germs to spread and why infection control actions work to stop them from spreading and making people sick. Next slide, please. The respiratory system as a reservoir. In this echo, we will explore the respiratory system as one of the body reservoirs with a focus on respiratory illnesses such as COVID, flu, and pertussis. In order to decrease the risk for respiratory illnesses, we will discuss how we can remove pathways that allow these respiratory germs to spread. Next slide, please. A review of the respiratory system reservoir and pathways. Infection control actions are connected to how respiratory germs spread from where they live in the respiratory system. Many germs live in the upper airways, such as the nose, mouth, throat, and windpipe. The defenses of the nose, mouth, and throat help keep a lot of these germs from getting into the lower airway in the lungs. There are several pathways for germs to be spread to and from, as well as within the respiratory system by breathing in, splash and spray, and touch. Next slide, please. Respiratory system risks. Through these pathways, the risks of respiratory infections happen when germs spread to and from and within the respiratory system. Breathing is an important pathway because germs can be spread through respiratory droplets. Respiratory droplets can spread by splashes and sprays to the eyes, nose, and mouth. Getting past the body's defenses with intubation can help germs spread and reach the lungs. Touch is also important because germs in the respiratory system spread easily to the skin and hands, and from there can be spread to other people and surfaces. Next slide, please. Respiratory infections, the general background about respiratory illnesses. Germs can live in the respiratory system in pathways that germs can spread within and to the respiratory reservoir. Most of the germs that are commonly found in the upper respiratory system keep those parts of the body healthy. Some germs are there because someone has an infection like a sore throat, but when those germs get into the airway or lungs, they can cause infection. Cough etiquette and hand hygiene help remove this pathway for respiratory illnesses to occur. Next slide, please. A deeper look into the respiratory illnesses. Coughing. Could it be COVID, the flu, or a new emerging respiratory illness? Let's use specific illnesses, including COVID, flu, and pertussis, to explore infection control actions for the respiratory reservoir. Next slide, please. COVID-19 can be mistaken for a cold, flu, or pneumonia. COVID variants continue to spread when droplets are breathed in, droplet sprays from sneezing or coughing, and touching of the nose or mouth with these droplets. Next slide, please. For COVID-19, masking, PPE, hand hygiene, and cleaning and disinfection stops how fast the virus spreads. Vaccination boosters and an exposure response plan help prevent more COVID variants from emerging when there are less infections. Next slide, please. Flu. How do you prevent the breathing in and touching of respiratory droplets when COVID and flu share similar symptoms of sore throat, coughing, and sneezing? The same infection control actions such as hand hygiene, PPE, cough etiquette, physical distancing, ventilation, cleaning and disinfection also stop surface contamination with the spread of respiratory influenza. Next slide, please. Pertussis. Similar to COVID and influenza, the respiratory bacteria that causes whooping cough spreads with coughing and sneezing. With pertussis, cough etiquette, masking for source control, hand hygiene, cleaning and disinfection, and vaccination are part of the same infection control program for the respiratory system reservoir. Next slide, please. Risk recognition strategies. Now bringing infection control of the respiratory system reservoir to your UIO. With understanding this reservoir and germ spread of respiratory illnesses, what questions come to mind when you hear a sneeze, a sniffle, or cough in your clinic waiting room? Mobile transport with a homebound senior, or handing out food in your distribution center? Some questions that might come to mind: what pathways might move the germs in and out of each reservoir? Could I cause germs to spread from a reservoir with my task? What other infection control actions can I take to help stop the spread of germs, prevent infections, and protect patients, myself, and my coworkers? Next slide, please. The general respiratory infection control actions. Taking the necessary steps to prevent respiratory germ spread includes monitoring the respiratory system reservoir and removing pathways with these infection control actions mentioned. Do all that you can with vaccination to prevent COVID, flu, and pertussis. If there are respiratory symptoms for healthcare workers or patients, test for COVID. If there is an exposure to COVID, flu, or pertussis with patients or staff, have a response plan in place, which might also involve local and state health authorities as appropriate. These same infection control actions are the same for UIOs providing home health, medical transport, mental health case management, or food distribution services. These are the same infection control actions you know and you use every day to prevent germ spread from the respiratory reservoir to causing a respiratory infection. Through the examples of COVID, pertussis, and influenza, we used risk recognition to understand how germs spread to, from, and within the respiratory reservoir. When there's a cough, let's take a closer look at these infection control actions for stopping spread of respiratory illnesses. Next slide, please. Next slide, please. Cough etiquette. Let's revisit this in more detail because it still works with current, reemerging, and new respiratory infections. Germs can infect patients when they breathe in respiratory droplets or touching something, such as a surface or object with respiratory germs on it, and then touching their mouth or nose. Wearing a mask that covers nose and mouth to prevent spread of respiratory droplets. Coughing into your elbow, cleaning your hands, and properly disposing of tissues. Physical distancing, ventilation, PPE, and cleaning and disinfection are also important in preventing the spread of influenza germs. Next slide, please. Hand hygiene. Hands are the universal pathway because your hands have lots of stuff on them, including germs from respiratory illnesses. Because you use your hands so much, they are a key way germs spread in respiratory illnesses when touching a surface with respiratory droplets and then touching your nose or mouth. Next slide, please. Hand washing etiquette. Let's explore the infection control action here. Wash hands in soap with water for at least 20 seconds. Use the cleanest water possible. Use an alcohol-based hand rub that contains 60% when water and soap are not available. And these are the circumstances in which you take infection control into your own hands when hand hygiene should happen. Immediately before touching a patient, before performing an aseptic task, before moving from a work that involves a soiled body site to a clean body site on that same patient. After touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after glove removal. Next slide, please. COVID infection control actions with the PPE. PPE is still a part of an infection control plan for respiratory illnesses, and they serve these two purposes: protecting the individual wearing the PPE, where gowns and gloves keep it from getting to, or germs from getting to the individual, as well as from spreading around the environment itself. And number two, protecting patients and coworkers from what the individual is wearing and what they could carry to you. Next slide, please. A reminder about PPE donning. You'll notice in the chat box that there is a training video that the CDC has shared, and depending on the type of additional precautions or risk assessment, a gown, goggles, mask, surgical or N95, face shield, and gloves are used during patient care. In the interest of times, I'll just quickly go through the steps of donning PPE gear. Just note that there's more than one method to do so, and it's completely acceptable to do other alternatives as well. Just ensuring that you are identifying and gathering the proper PPE that you need, performing hand hygiene, putting on the isolation gown, using the N95, a respirator, a face mask, putting on face shield or goggles, putting on gloves, and then you are ready to enter the patient room. Next slide, please. A reminder of PPE doffing. You'll note again in the chat box that there's a training video for doing so properly. And again, there may be more than one method for doing so, and that's completely acceptable. There may be times when it's appropriate to modify this sequence for that reason. For example, if your face shield is sprayed with blood, you may want to keep your gloves on so you can remove that, as well as keeping your gown on before removing the face shield. And also, it's important in thinking through when you are doffing PPE that you have a critical rationale for that methodology. Again, in the interest of time, I'll just go quickly through the steps: removing your gloves, removing your gown, and exiting the patient room. You should perform hand hygiene, remove your face shield, goggles, respirator, face mask, and again, performing hand hygiene. And please note, facilities implementing reuse or extended use of PPE may need to adjust their donning and doffing procedures accordingly. And so now I'll transition back to Sophie for introducing Dr. Carlson. Thank you.
Thank you, Karen, for that wonderful lecture. So we'll now transition to Dr. Carlson to provide some commentary. And I'd just like to remind everyone that today's session isn't ending here, so we will be discussing 2 cases after Dr. Carlson's commentary. Next slide. So Dr. Abigail Carlson is one of the Infection Control Advisor and Subject Matter Experts for Project Firstline, CDC's new training collaboration for healthcare infection and control. She is with the CDC's Division of Healthcare Quality Promotion. And I will transition and pass it over to Dr. Carlson. Thank you.
Thank you, Sophie. If we could get the next slide, please. This is just the relevant disclosures. I make no money from anywhere but the federal government, and we're not going to talk about any other devices or products. I have a very short commentary. And this is mostly not pre-planned because I wanted to leave a lot of time for discussion of the cases. I think that they will be very helpful to understanding a lot of the concepts that Karen talked about in the initial lecture on the subject of pathways and reservoirs, things that we've been touching on for the last couple of echoes now, but that I think are really best illustrated in these case-based scenarios and discussions of the literature. I think we're all really, I won't say tired, but I think we're all, we're a little bit numb to the respiratory pathway at this point and the respiratory reservoir, in part because we have been dealing with COVID now for over 2 years. And our world has been focused on that, right? And a lot of our infection control has been completely focused on that. And so we feel like we're very strong in this area. And in many ways we are, certainly much stronger in terms of preventing infection from the respiratory reservoir than we have been in the past. What I do think that is coming to light, particularly with monkeypox, is that some of the things that we have thought about, that we had thought about before the pandemic, were lost in the midst of COVID, and they're starting to come back, and we need to think a little bit more about the respiratory reservoir and the risks that it poses both to each other and to patients. The thing about respiratory infections that is obviously the hardest is that they pass through the air, right? And so keeping respiratory infections out of the air has been a major focus of what we do. But what's missed in that process is that there are many diseases that are respiratory pathogens, but that are really transmitted by touch or transmitted by splashes and sprays. And as you look around and you think about how you've set things up for infection control in your facility, you may want to think about those pathways as well. Those are the pathways by which, for example, monkeypox spreads. It's mostly a contact disease, not a respiratory disease through the air pathway. the common cold, about 25% of the common cold is caused by cousins of SARS-CoV-2. So other coronaviruses, some more distant cousins than others. But 75% of common colds are caused by rhinoviruses and adenoviruses and other viruses that actually have a larger touch component. Flu is more likely to spread by touch than COVID is. And so it's worth thinking about that as well. So looking at some of those pathways that we have not neglected, but they've been in a different corner of our minds for a while, and thinking about how they apply to the world as it is becoming, the post or second stage COVID world, and using that process to strengthen your infection control practices. I think the other thing I would say is that, there are other diseases that we need to think about beyond COVID, and certainly, one of them that has been a concern in Native American communities throughout North America has been tuberculosis. More prevalent in some communities than others, in some nations and tribes than in others. But it's very different dealing with tuberculosis than dealing with COVID in some ways. And so you want to be able to think about, well, if this case is tuberculosis, should we be doing something different? And how do I recognize that this is not, COVID or flu, that this is tuberculosis? What do I do about that? You can think about that. We talked as a group kind of last week when we were preparing for this about some of the other situations that you face in UIOs where it's not clinical, but rather, for example, as Karen pointed out, when people come in for food assistance or other social services, how do you identify people who are at risk of having other respiratory diseases? What do you do for those people and for your staff to protect everyone as they get their services, knowing that you're not engaged in a medical or diagnostic process? Do you have a way to feed them into the medical or the diagnostic process so that they get care for their symptoms at the same time that they're getting their social care? So a lot of different factors to think about when you think about the respiratory reservoir and pathways in and out. It's probably one of the most difficult reservoirs to deal with because of all of its pathways. But it also is one of those things where when you get down to it, the list of things you do to protect people from respiratory pathogens is actually relatively small. The devil's in the details as always, but the main things are things like masking, things like hand hygiene, things like keeping people distanced. And so those, keep coming back to those basics because they serve you well. And as you go through your facilities and go through your communities and think through some of these elements, I think you'll find those themes reemerging. And as long as those base practices are strong, often, the details are important, don't misunderstand me, but they are going to finesse small issues as opposed to a problem with your base practices, which if you have a problem with one of your fundamental practices, the chances of something bad happening become much larger very quickly. So with that, I want to stop and transition back to Sophie to get us going with the rest of our discussion.
Wonderful. Thank you so much, Dr. Carlson, for your input and your commentary. So now we're going to transition to our case discussion, and this is going to be facilitated by Alyssa. So I'll hand it over to you, Alyssa.
Thank you, Sophie. Next slide, please. So hello, everyone. I will be filling, next slide. Well, my name's Alyssa. I'll be filling in for Marie today. Just to introduce myself really briefly, I'm a registered nurse and a public health associate with NCUIH. I'm also a descendant of the Fort Peck, Assiniboine, and Sioux tribes. Next slide, please. Today we'll be discussing two cases. Excuse me. The first one, we will look at COVID-19 infections among healthcare workers who were exposed to a patient with a delayed diagnosis of COVID-19. The second case will explore contamination of healthcare workers with mobile phones. And I just want to remind everyone that the recording will cease now and that any protected health information or identifying information will not be shared.